Good afternoon, and welcome to today's briefing from the St. Louis Metropolitan Pandemic Task Force. Before we get started on today's briefing, I just want to bring the good news that Dr. Alex Garza has returned to St. Louis from his recent deployment in the Middle East. It's really great to have Dr. Garza back, and going forward, he and I will be sharing responsibilities for Pandemic Task Force meetings and communications. So good to have him back, particularly at a time when things are starting to heat up. Moving on to the briefing for today, we do need to talk a little bit about the Omicron variant. It's certainly been in the news a lot, and I'll just bring you what information we have at this point and talk about where we're going to go from here. But we also need to get an update on regional data, and in particular talking about surging cases and what might be causing that, and what we can do about it, in particular the effectiveness of masking to help prevent spread, and of vaccinations. And then I've already given you the update on briefings, but I'll just say going forward we'll probably be doing these briefings every other week, but there'll be some other media statements in the gaps in between if we need them. So first, Omicron. What is Omicron? It is the latest variant. It's been reported mostly in South Africa, but a number of countries in the world have already identified patients who have COVID infections with Omicron. It appears to be relatively easily transmitted, perhaps more so than Delta. We don't know that for sure yet, but there is really no reason to believe that it won't sweep across the world and become a new variant for us to worry about. How quickly that will happen is uncertain. There are a lot of travel restrictions being imposed on individuals leaving South Africa. Those may slow it down some, but I think there's every reason to believe that it'll soon be widespread. There's more to come on that. Right now, what we're looking for is information about how the mutations that created the Omicron variant affect the infectivity of it, that is, how quickly or how easily can it be transmitted, how virulent it is, that is, how serious is the disease it causes. And then finally, do the mutations give it some sort of way to escape the immunity that's produced either by vaccination or by natural infection? So we don't have answers on any of those things. I will say now and emphasize again later, it's very reasonable to assume that current vaccinations will provide some protection against the Omicron variant. What we don't know yet is the degree of that protection. But again, we'll come back to vaccination in a moment. With that aside, let's look at what's happening in the U.S. and in the St. Louis region. This is the epidemic curve in pink and red on the left, and the death curve on the right for the United States. And we can see that there's been this upturn in November after a period of steady decline. It looks like there's a drop at the very end of this graphic. Please be aware that many states, many public health departments weren't reporting data during the Thanksgiving holidays, and that's really going to cause a bit of a notch in statistics. We saw something very similar last year. If you look in the end of 2020 and the beginning of 2021, you see a couple of deep notches in that graph. That's the same phenomena of decreases in reporting. So no reason to think that this current surge is abating in any way. Looking at the map, this is mainly a problem in the upper Midwest and now New England, where rates have increased pretty substantially. Michigan is once again leading the country in terms of the number of new infections, but many other areas have noted pretty strong increases. We've also seen an increase in case rates in the St. Louis region. Again, this shows the reporting by day. Each little green bar represents 1 day of reporting, and the blue line is the rolling 7-day average, which is intended to smooth out some of those peaks and valleys. The very high spikes at the right end of this, which are recent days in the St. Louis region, really reflect mostly reporting artifacts. We're definitely in an upward trend, but those extremely high numbers reflect a number of cases being reported all in 1 day. Our indicators are likewise thrown off a little bit by these reporting lags. This shows that the week-over-week 14-day rolling average increase was only 12%, and that's actually lower than what the real number probably is. And likewise, our transmission number, which we always want to see below 1, and looks like it's below 1 here at a 0.97, but I believe that's also artifactually low because of the gaps in reporting over the Thanksgiving holidays. So we'll look ahead a week or two to see that number in a more reliable position. On the other hand, hospital data isn't subject to reporting lags. We look at those numbers every day. We know how many patients are admitted to St. Louis area hospitals and how many are in our four walls. This shows this upturn. A few weeks ago, we talked about the fact that hospitalizations had not been increasing along with case rates in the region, but now we have the answer of whether that was a new phenomena or whether we were just seeing the hospitalizations lag behind case rates, and that's exactly what has happened. Now that we're a few weeks later, we can see an increase in the number of individuals being hospitalized. The 7-day moving average is 48, which is well above the low point that we achieved towards the beginning of November. Currently, we have 364 people in hospital and task force hospitals with a 7-day moving average of 340, and that's increasing. So we are absolutely going in the wrong direction in terms of hitting health system resources to take care of COVID patients. In addition to the 364 that are in hospital beds and task force hospital beds, there are 79 patients in ICU, 51 on ventilators. Again, those numbers are up quite a bit. And our numbers for pediatrics are up a little bit from the last report. We have 9 cases in as of today, although none are in ICU. The COVID death rates for patients who are hospitalized in task force hospitals has also turned up just a little bit. Our 7-day moving average is up to 6 deaths a day. Again, I'll remind you that not all cases or deaths are in the task force hospitals, but about 85% of them are. The question of breakthrough cases always comes up. We're still running around 25% of patients in hospital are breakthrough cases. The majority of those individuals are older or have diseases that either compromise their immune system or put them at risk for suffering more severe symptoms with COVID. The fact remains that people who are relatively healthy, who are vaccinated, have very little chance of being admitted to the hospital, although some may still feel pretty sick with high fever and the like in breakthrough cases. This looks at breakthrough cases over time. Just to orient you, the bars show the total number of individuals admitted to a hospital. The blue bars are unvaccinated and the orange bars are vaccinated. Again, a clear predominance of admissions coming among the unvaccinated. The white line shows the percentage of people each day who are vaccinated, or the percentage of hospitalized patients that represent breakthrough cases. This number has been climbing, and that likely reflects some waning immunity, particularly in vulnerable populations. So for individuals who are predisposed to more serious cases, their waning immunity takes effect or causes problems sooner than it does for the rest of the population. But right now we're running right at 25%, again, proving, I think, that vaccine offers substantial protection, particularly for those who are otherwise healthy. Forecasting, this model has changed significantly since the last time we spoke. This looks at inpatient census in the region, and you can see that clear upturn in the number of cases at the far right with the black dots. Those blue lines are our best guesses as of a week ago. Those numbers will also shift up because we're definitely on a steeper trajectory in terms of the increase in case rates and hospitalizations. We did over 300 monoclonal antibody infusions in the week of November the 8th. That's the most we've done, I think, in 1 week, or very close to it. and that continues to be the most reliable treatment for individuals who become infected with COVID. If you develop a COVID infection and want to know if you're a candidate for an infusion, please contact your doctor or call one of the hospital health system helplines to give you direction on that. Of course, the real answer to this is vaccination. These are the most recent vaccination numbers. Nationally, we're pushing 70% in the total population. That's more than 3/4 of the eligible population. In Missouri, we're lagging behind that. St. Louis is getting close to having 60% of eligibles, 60% of the total population having at least one shot, and now we're inching above 50% having a completed vaccine series. We really need to get these numbers up higher, particularly with the threat of Omicron on the horizon. The higher the vaccination levels, the less impact that new variants will have on the population. This graphic shows you vaccination rates by county of the St. Louis Metropolitan Statistical Area. I'll leave them to your review on the website or the Facebook page if you so desire. I do want to remind you that while this shows increased vaccination rates in certain counties in the region, it's really a more variable story than that. If you look at the zip code level, and these are data for the Missouri side of the St. Louis area, you can see that there's much higher vaccination rates in that central corridor, and that there are some real gaps in vaccination rates in North St. Louis City and County and in the more rural portions of the St. Louis metropolitan area. That's a pattern that has continued since almost the very beginning of vaccinations, and we really strongly encourage those individuals in areas where vaccinations are not being used as vigorously to please reconsider getting a vaccination as quickly as possible. A final reminder is that while we have all our eyes on COVID and on the Omicron variant, influenza has made its presence felt in the U.S. This is a map from the CDC showing states with influenza activity. New Mexico is particularly strong. You can also see Georgia having pretty substantial activity. Missouri is really in the low, pushing moderate activity, and we have had several hundred cases in Missouri. If you have not gotten a flu shot, it's never too late. This would be a really good time to do it before flu becomes transmitted more widely in our region. Okay, with the data and information behind us, we'll move on to talking about some of the questions that we've been fielding and some of the questions that you may have. So the first is, should St. Louisans be worried about Omicron? And I think the short answer is there is no reason for panic. There is good reason to believe that the measures that we've undertaken to protect against Delta and previous variants will be effective for Omicron. Masking and social distancing continue to be effective. We've seen throughout the pandemic that areas with higher masking rates tend to have lower infection rates, and we know that at the beginning we had a substantial reduction in the impact on St. Louis from public health actions of that type. In addition, while we don't yet know whether vaccines are fully protective against Omicron, there is a lot of evidence and good reason to believe that vaccines will protect against serious disease, particularly those who have received booster doses. If you are considering a booster dose, I wouldn't hesitate to go out and get it. And as some of you may have read, yesterday or the day before, the CDC came out in favor of having everyone who is vaccine eligible and eligible for a booster to receive it. I agree with that advice. I think that's a prudent step that people can take to protect themselves against the potential threat. The next part of that question is, how are hospitals tracking Omicron, and the question about wastewater effectiveness. Some samples are being sent for genetic sequencing. That's what we have to really tell whether we have the Omicron variant. So far, we haven't turned any of those up. In Missouri, there is a very active wastewater surveillance process, and that's a very clever strategy to see if a particular variant has entered the region. And no doubt that the project that's monitoring wastewater will continue to do that and hopefully give us an early warning signal that Omicron has entered the region. That said, I don't think our directives are going to change particularly. If you haven't been vaccinated, get vaccinated. If you've been vaccinated but not yet boosted, get your booster. And above all, wear masks and avoid crowding in public places, particularly with individuals whose vaccine status is unknown. The next question is, how serious a threat is Omicron to another surge? I think we are in the middle of a winter surge, as we talked about might happen. I think Omicron will add fuel to that fire and likely, if anything, enhance. But I don't think that we need to look to Omicron to be concerned about the patterns that we're seeing in the community. So once again, I think it's time to be very prudent and to take steps to curb spread of COVID. There are early reports from South Africa that Omicron cases seem relatively mild. That may or may not be the case. The initial event that appears to be reported from South Africa involved a group of university students who were on a field trip on a bus, and they developed an outbreak or a cluster of Omicron infections. Of course, they were university students, so they are younger, unlikely to suffer serious disease, and I think it'd be difficult to draw overall conclusions about how severe infections with Omicron might be. I think we simply need more data on that. We don't have any evidence so far that Omicron will cause worse disease than Delta, but I think the jury is still out, so let's wait for more information. I've already covered what actions that you can take to protect yourselves and others. And the final question here is, are the signs and symptoms the same? And how will we know if we have it? Thus far, we don't have any evidence that the signs and symptoms will be different. I suspect that any individual won't have any idea what variant they have or whether they might have the flu instead. So if you develop a respiratory illness, please go for testing to figure out whether it's flu, for which there are antiviral therapies available, or COVID, which can be treated with monoclonal antibody. The final questions concern the current surge we're seeing in cases. And the question is, what is causing the surge? I think there are several factors playing into the current surge. Probably the most important are that we're entering colder weather and people are gathering indoors. And this is coinciding with sort of being fed up, people being fed up with wearing masks and not doing their normal activities. So with more at-risk behavior and closer quarters, it's really providing a good opportunity for spread of the virus. I would add to that, with each passing day, we do know that immunity wanes and that Delta is somewhat more resistant to vaccine immunity than some of the original strains. So that may be adding some to the surge that we're seeing. But right now, I would say that the dominant impact for the surge is likely crowding indoors and people foregoing masks and social distancing. The next question is, can it be shared about who is in the hospital? We're not seeing a particular difference in the types of people that are being admitted to the hospital. As I've covered earlier, the breakthrough cases tend to be individuals who are older or who have diseases that either compromise their immune system or make their response to COVID infection more difficult. Among those who are unvaccinated, it's really affecting all age stratas and all parts of the community. So I don't think anyone could take solace in feeling like there's no risk to them. COVID continues to strike pretty much in every quarter, particularly among unvaccinated. And then finally, there's a question about the main differences between a pandemic disease and an endemic disease and how we'll know when COVID moves from one to the other. In pandemics or epidemics, disease is spreading quickly in the population, and it's sort of a uncontrolled spread and moves rapidly through large numbers of people. Endemic diseases are ones that have a less spread. They tend to be more things that pop up in clusters but don't perpetuate. So when we are in endemic status, a single case won't necessarily set off a chain of new infections. But in either case, right now, COVID doesn't appear to be moving into an endemic phase, and we need to continue to respond to it as a pandemic disease. That concludes the questions for today. Hopefully, I've been able to cover some of the most important topics. If you have other questions, please submit them, and we'll look forward to talking to you again in the near future. Thank you.